The Parliament has set the date for an extraordinary session debate for 26th and 27th October as formally requested by the Cabinet, where Cabinet members of the Parliament, and senators will discuss the current political crisis. The extraordinary session will commence at 9 a.m. on October 26th. The Parliament has set a 25-hour time limit for the session, with 8 hours allocated to opposition parties, 5 hours to the Cabinet, 5 hours to coalition parties, and 2 hours to the House Speaker. While Democrat Party leader Jordan Laksanawisit said the party has set up MPs to a meeting to prepare the topics and speakers for the debate as a coalition party, with the debate to be constructive, seeking resolutions to the current issues, while showing that the people can still trust Parliament to find a way out and avoid violence. Meanwhile, Secretary General of the Palang Pracharat Party, Anucha Nakasai, said the government is sincerely seeking a resolution to the current crisis and asked Parliament to open an extraordinary session according to Article 165 in order to gather input from members of Parliament. He stressed that the party prefers to use Parliament as the way to find a resolution, in line with democratic principles.
Prime Minister General Prayut Chan-o-cha told the Center for COVID-19 Situation Administration, or CCSA, to speed up the procurement of coronavirus vaccines as soon as the vaccine becomes available. The Prime Minister's order was given to the CCSA meeting on Friday. The administration has already approved a 1 billion baht fund for the procurement to be handled by the National Vaccine Institute. The government has set aside 400 million baht in research and development and is working hand in hand with foreign R&D teams on knowledge and technology transfers under a budget of 600 million baht. The CCSA expects that about 26 million doses of vaccines will be produced by the Siam Bioscience Company at the end of November, which will be enough for 20% of the Thai population. In addition, the Ministry of Public Health has sent a letter of intent to the COVAX facility declaring Thailand's intention to join its search for a vaccine. COVAX facility is a global initiative that brings together governments and manufacturers to ensure eventual COVID-19 vaccines reach those in greatest need.
The Minister of Public Health has flown to the Samui Island to inspect and deliver antiviral drugs to local hospitals after the confirmation of a French national being tested positive for COVID-19 on the island, even after clearing 14 days in quarantine. Public Health Minister Anutin Chandragul has traveled to Koh Samui to deliver 1,000 tablets of the Favipiravir antiviral drugs to local hospitals. Favipiravir has been cleared for COVID-19 treatment in patients with severe symptoms in Thailand. The delivery of this antiviral drug follows the confirmation that a female French national tested positive for the virus on the island, even after having completed her 14 days in quarantine. The minister said the patient could have contracted the virus at the quarantine facility, and health authorities must find these loopholes to address them. He further stated that the general public should not worry, as the health and safety measures currently in Thailand are stringent, and all health officials are working their best to prevent the spread. Mr. Anutin said the area where the patient was found has been restricted, with all close contacts traced for testing in a timely manner, reassuring the general public that there is no need to panic over the situation.